This afternoon, we have a host of stories to tell you about the novel coronavirus. Right now, though, there is a quick update that's just coming in. We need to go quickly to the Korle Bu Teaching Hospital, where the Deputy Director General of the Ghana Health Service, Dr. Bequin, is addressing the media. We can listen to him now.
Threats that we are responding to, and the expertise cut across. So I want that taken to be across. So when it comes to the coordination, it's normally coordinated by the DG of Ghana Health Service, and normally it's co-chaired by the country rep of WHO. So that has been the coordination, and then we have various representations from ambulance, 37, and I think that maybe it's a omission. I think that Dr. Asari should be part of the next meeting. I think that I will accept that responsibility. But I send the invitations out. And I know Dr. Polampo is a part of it. And there are few from Korle Bu on it. So that's the coordination. These people actually give direction to how the outbreak should be managed. So that's the technical side. And then we go to surveillance. Surveillance, I know there are people in Kofanoche, there are people in other facilities that are trying to see how can we early detect diseases which occur in the country. So we have case definitions that have been sent. Just this afternoon, I was with Dr. Amo and the team trying to see the new case base form that we are supposed to use. But this is a novel disease that has come. So what we are using are old. And let me say, WHO keeps on changing the form. I called WHO yesterday, and the form we're using, they have to change it. So it's a revolving outbreak. So all I'm trying to say is that there will be new things that will be coming, and we are working to it together. So there's this channel called the surveillance channel. Then we go to the lab. The lab currently now, our main lab for focus or confirmation is Noguchi. So if we suspect a case, samples will be taken, either nasopharyngeal swab or throat swab, and then it's sent to Noguchi where there's confirmation. There's also cases here in Kumasi which also has a capacity to confirm a case. So that's for lab. Then you come to case management. Today, I think there was an issue with me and Dr. Amon on Joy FM. When you talk about case management, it's about treating cases. So it is not about Ghana Health Service. It's not about Korle Bu. It's about how you treat the cases. And let me say that currently down in Ghana, we don't have an infectious disease hospital. So what we are doing is a stopgap measure. And the stopgap measure is that they have this facility that sits in Tema. And Dr. Asari is aware of it. Yes, so in Tema and they are enraged. But then the plan of the minister is that since Korle Bu is the house of expertise, they are going to also look at what Korle Bu can offer. So clearly, if you look at the Ebola time, I think Korle Bu was earmarked to serve a purpose, but it was not completed. So though Korle Bu has expertise, it doesn't got the physical presence to say that we are going to handle corona. So for now, there are two designated centers, is Rick and Tema, but Korle Bu is the next line. Then there's something like Gan East. Gan East is a newly built hospital, but it's blank. So the idea is that as if we have several cases occur in Ghana, we need to have a big place to handle them. So that's the direction for case management. So all I'm trying to say is that in managing coronavirus, it is not Ghana Health Service, it is not Korle Bu. It's expertise that exists in the country who are addressing. It goes to risk communication. It cuts across UNICEF, WHO, Ghana Health Service, teaching hospitals, but they are all persons that are in together to make sure that we have the expertise together. We have logistics, which is very, very crucial. PPEs. Yesterday, before I heard of this problem in Korle Bu, I was with my director and we were doing allocation of PPEs in the country. We had 5,000 PPEs. And by the time we are finished allocating, it was only 5. We were giving Korle Bu 200. Later I got to know that Korle Bu even had a case. Actually, Dr. Polampo called me around 8 p.m. I had to come and see. So all I'm saying is that we are in an evolving outbreak. A lot of things are going to change. But let's try and have a concerted effort. And then we can address the challenges that will occur. So we are happy that the case that occurred in Korle Bu was early picked. Clearly, we look at the case definition, it was not wholly hitting it. But I think the clinicians thought that it could be coronavirus. So to me, as a country, So, currently, as I speak as a country, we have picked 9 cases, and all the 9 are negative. So there's no coronavirus in Ghana now. But I want to assure all of us that let's be vigilant. Okay. So all I'm saying is that please let's work together for the sake of Ghana and for the betterment of Ghanaians. Thank you very much.
Thank you very much, Dr. Sedu. And I want to appeal to all of you, especially the frontline staff. They've supplied a lot of PPEs and has gone to the public health. The Director of Nursing Service and DMA will see to the distribution to make sure that everyone gets the PPE. The government does not need to give us money. They will have to support us. Listen, nobody should use this to give me money. The monetization must stop now. I don't want anybody. This is not a program. All of us are in the sea. So with that, you are assured Ghana is safe, Kolebu is safe, we don't have coronavirus. We have enough PPEs to go for everybody. Thank you very much.
Thank you, Chief, for the closing remarks. We now call Mrs. Grace Anyomi to give us the vote of thanks. Let us put our hands together for Mrs. Anyomi to give us.
And whilst they do the vote of thanks, I'm just going to quickly take you through what they've been saying. So you just heard that the CEO of the Kolebu Teaching Hospital, Dr. Daniel Asari, who was speaking about the arrival of PPEs. He says they're going to be distributed and we'll be following that as well. But before him was a Deputy Director of the Public Health, which is Dr. Asiedu Bekwin, who is also the Deputy Director of the Ghana Health Service. He spoke extensively about the situation as far as coronavirus is concerned. This is supposed to be a sensitization engagement. So first, he talks about early detection, which is key. He talks about new cases and how they're supposed to be handled. But he says that this is a new virus. This is a virus that has not yet been identified. We only know that it is in the family of coronavirus and that they're checking the formula. He says even though we've dealt with pandemics before, the formula for this might change. In fact, he said he's spoken to WHO and they're saying that the formula as far as the case management, etc., keeps changing. And so they are looking at that. He talks about the stopgap measures that are being made, and he says Tema General Hospital and the Ridge Hospital, or the Greater Accra Region Hospital, they have the physical facilities to manage some of these cases, but Kolebu Teaching Hospital, of course, has the expertise. He talks about the fact that this is an evolving outbreak, and so they're managing things. He says 9 cases so far, 9 cases or suspected cases have been tested and all have proven negative. And he concludes by saying that there is no coronavirus in Ghana, but he's calling for vigilance against these. Now, let me take you through the stories that we have for you as far as coronavirus is concerned. Now, we know the test result also from blood samples of 2 people suspected to be carrying the novel coronavirus have proven negative. The 2 individuals, one Chinese and an Argentine, showed up at the Kolebu Teaching Hospital yesterday with symptoms similar to those associated with the disease. Here is what you need to know as far as these cases, which were just confirmed negative, are concerned. All right, so a 25-year-old Argentine and a Chinese national, they were both brought to the Kolebu Teaching Hospital yesterday by a national coordinating team after they complained of cold, body pains and high temperature. That's the first fact to know about these 2 people, these 2 cases that were just tested yesterday. What we also know is that the Chinese lives at Osu here in Accra. He has been moving in and out of China since September. And as you know, some people have said that the outbreak actually started earlier in China than reported. So that's a point to note there. He has also been to Ivory Coast, and we know that there was a suspected case in Ivory Coast which subsequently tested negative. So these are some of the facts we know about these 2 people. His Argentine counterpart arrived in Ghana from Shanghai on January 24. If you remember, this disease started, I mean, it became a full-blown outbreak by 7th of January. So this gentleman returned from Shanghai on 24th of January and stayed with this Chinese national. They both left for Sao Tome and Principe on January 25, 2020, and were told that they returned on February 1, 2020. So they've been around. They've been moving around, especially the fact that they're from, they've had some stings with China. It's created cause for worry. On February 3, 2020, though, they complained about constitutional symptoms. And by constitutional, you know, some of the symptoms that you are to expect as far as this novel coronavirus is concerned. It included chest tightness, nasal discharge, a mild cold, lower back pain, and bodily pains. So these are, again, some of the things that you should look out for. And so they were brought to the Kofi Boni Teaching Hospital on Thursday, which was today at 3 p.m. for tests to rule out meningitis, which was the initially suspected sickness. Coronavirus was suspected because a Chinese national was involved and because these two people have had some sort of relationship with China in January up until now. So their samples were eventually taken to Noguchi Memorial Research Center on the same day at about 6 p.m. and the two suspected cases look okay. We're told that they were sitting and chatting in a holding area at the Emergency and Accident Center at the Kofi Boni Teaching Hospital. What more do we know? Two Ghanaian health professionals who came into contact with the foreigners have also gone into self-isolation. The Emergency and Accident Center has been locked down. That's according to a doctor at the Kofi Boni Teaching Hospital. Authorities at Kofi Boni Teaching Hospital have stepped up security after one of the suspects is said to have left the holding facility to go get some food. Now, what you know is that when you are suspected to have a case like this, you need to be quarantined because they need to run checks on you to be sure that you don't have the disease. Because even during the incubation time, we're told that you can still spread it, even though more tests are ongoing. Now, the Noguchi Memorial Center Research Center has completed tests on the two suspected cases and we're told they came out negative. You just heard Dr. Issah Musah indicates that, in fact, 9 more people or 9 more cases have also been tested. What we don't know is whether they are different from these 2 cases or they add up to the 9. Head of our health desk, Fred Smith, is on the ground for us. He joins me live. Hello, Fred.
Hello, Gifty.
Fred, do tell us. We just heard Dr. Issah Musah there talking to the people. I believe this is part of the sensitization and the outreach programs. Tell us, what more should we know from where you are? Fred, I believe that you do hear me. I mean, there's a bit of a delay, which is how this thing usually works. But if you do hear me, I'm asking for you to tell us what more we should know from your location, which we're told had been the holding area for 2 suspected cases.
Well, Gifty, line is not so clear, but if you're asking me about the holding area, I have been there. It's at the fevers unit of the hospital, and that's where the 2 men are said to be under quarantine. Nobody's allowing them to move out now after the earlier scare last night. We are told that the Chinese left and went out. Officials are saying that, well, it was yes, went out to get food and came back. But we have been told also by staff here that he actually ran away from the facility and the security police was called to go and get him back. And so that's what the situation is right now. Anything else, it's the update from the health ministry, which is saying that up to 9 suspected cases have been tested and they've all proved negative.
Well, Fred, I hope that this gets a bit smoother as we go along, but We had Dr. Asiedu say that 9 cases have so far been tested and they've all proven negative. I just want to find out, are these 2 cases that suspected cases that we just dealt with different from the 9, or do they add up to that figure?
Well, the 2 cases we had at Kolebu add up to the 7 that they've earlier recorded, and that makes the 9. So the 9 cases recorded includes the 2 which we're talking about at Kolebu.
So back to this, the 2 people who were quarantined. I am just at a loss here. How were they quarantined but were able to go out to buy food or were able to run away? Give us an idea. When they say people have been quarantined at the holding area, what does it look like?
Well, Gifty, this is embarrassing, and so no official would like to go on record to explain this because it is so embarrassing. It's a lesson well learned. If this turned out to be a positive case, then the country would have really been in a very difficult situation with all of these people going out and interacting with others. If indeed this man went out to get food, he would have interacted with this woman or man, whoever is selling the food. And so it would have been a very embarrassing situation for the health service. Luckily, they have tested negative and the risk is almost none.
We'll get more from Fred Smith when he joins us back here in studio. Fred Smith is head of our health desk. He's been at the Kolebu Teaching Hospital checking out the situation there for us. But we told you earlier that the Noguchi Memorial Institute for Medical Research is also running some tests. They've said that they'll be updating us on some sensitization program as well. I do have one of them, Dr. Kofi Boni. He's a senior research fellow at the institute who joins us on the line. Hello, Doc. Thank you very much for your time this afternoon.
Yeah, thank you for the opportunity.
Just to satisfy Ghanaians that we're really on track here, we heard last week, actually this week, that the test kits will be ready by next week. But then today we're hearing that tests have already been run. How did we get to the results if we did not have the test kits? Help us.
Oh, I'm not sure about the information that you just passed, but I thought you had a Professor Ampofo, my boss, came to your studio and told you that the test kit would be ready this week. So it came about Monday or Tuesday. I think it got here about Monday. So we already have the test kit, yes.
Okay. And as far as test kits are concerned, are these test kits usually, if you can give us a mental picture, just something that you use to test, what this virus contains, or is it something that comes with a full complement of protective gear for frontline health workers like yourself?
You're talking about the PPE. The test kit is for the current virus that is circulating. That is the new coronavirus. Mm-hmm. So because it's the new coronavirus, we have the old SARS and the MERS-CoV already. Mm-hmm. So because this one is new, we got the test kit for this particular one. So basically what it does is you take a sample of a suspected case, mm-hmm. and you try to find out whether the virus is in that person. That is basically what.
Okay. I just wanted to satisfy my ignorance, and also I'm sure for those who are watching us, also to understand that the PPE is separate or is different from the
PPE
testing.
is the personal protective equipment. So it involves the gloves, the gown, mm-hmm. and all the protective gear that you wear to work on the specimen that you use.
Right. So back to part of my earlier question, are these available to frontline workers like yourself?
Yes. So Noguchi, they have personal protective equipment that you use to do our work. Noguchi is basically research, so we have these things there already that we use to.
Okay. What from your perspective should the public know about this? Yesterday there was almost national panic of sort when news was just going round that coronavirus has been recorded. Of course, these were suspected cases, but what should people know to calm, their nerves as far as this new virus?
For us here at Noguchi, we have to support the health system. One of our mandates is to offer specialized diagnostic testing to support the Ghana health service. So I don't know what people were saying. We were here that they brought in samples that they suspect to be coronavirus. They wanted us to help to test them to either confirm or otherwise. Basically, that is what we do, or that is what we are supposed to be doing. That's what we do.
Right. We've just also heard from the Dr. Asedu Bekwin, and one of the things he said was that this is an evolving outbreak. Essentially, what he's saying is that a lot is not known about this particular virus. Indeed, it's a new coronavirus. Would you have any education for the public at this point? What more do we know about this?
Yes, I mean, from what we have been hearing from the news, I mean, China and all that, we can say that we are still learning more about this virus, because, yes, we talk about the mode of transmission for airborne virus. Somebody sneezes or coughs, we can catch it. But this one, they are adding that somebody who is not even showing symptoms can still transmit this virus. So this is one of the things that makes it a bit tricky. And so they are getting more information about this virus. For us here in Ghana, I mean, what we know is they have done some basic tests on the first cases that they had in China, and they have come out with testing kits. I mean, something that can be used to detect this particular virus.
Yeah.
So we have that testing kit, and we can now use this to diagnose any suspected case that. Yes.
Okay. And you talk about the fact that sometimes people who have it don't even show the symptoms. We've heard, and I learned in one of the news bulletins from China that even though, you know, it looks like it's become standardized that the incubation period for some of these coronaviruses is between 10 to 14 days, it's actually apparent in this particular one that even during the incubation period, people can still pass the disease on. How true is this?
Yeah, so that's the information we've already gotten to know. Sometimes the incubation period, that means that the person has to develop and get viremic levels of the agent, the virus, before he can start showing symptoms. Then after showing symptoms, you can then pass on the virus to others. But what we are reading about this particular one is that even before you start showing symptoms, you can have the ability to pass on the virus to other people. That is why they are saying that a lot has to be known about this particular virus. There are a lot of things that we still don't know about. The route of transmission is a bit cryptic, and that's that people are still looking.
You indicated, yes, please go ahead.
Yes, and so we're still doing more research to what this virus is all about.
You indicated that this is a bit tricky. To what extent is it very different from the other viruses or pandemics that we've had to deal with?
So if we talk about the MERS-CoV, which is also coronavirus, you see, one has to start showing symptoms. The common symptoms being you have fever, clearly your temperature will be more than 37. Then you have cough or sore throat, coughing, so sometimes running. So these are symptoms that you show for most of the respiratory infections. But sometimes you don't go for this one, you don't even get to that level showing those symptoms. And the person who is infected and incubating the virus can even have that ability to pass on the virus to others, even without showing the symptoms. You are atypical and you are still giving out the virus. That is what they mean by that is a bit different from what we have seen or what we have seen before.
Yeah. And typically, how long will it take any country or an institution like Noguchi to find out the details in such outbreaks?
To find out the what?
To find out the details, to get more information as to, you know, how to manage the cases, etc.
For proper research on this virus, Noguchi currently is not doing any research. We are doing testing as we speak. So basically what we are doing is, if there is a suspected case in any facility in the country and they bring the case to us, then Noguchi will have the ability to test, to just give the information, give the feedback to the facility that, or through the Ghana Health Service, that so this is what we had. For now, we are not doing any research to come up to know
what caused it. Okay.
Yes.
Okay.
Yes.
I'm sure that with time we'll get there. I'll let you go, Doc. But before that, I just wanted to find out. You indicated that 37 degrees. You're looking at fever and some of the respiratory infection symptoms, etc. But with this, sometimes the person may not show it. But we also heard that there is a combination of symptoms, that shows or that gives someone up to be accounted for as a suspected case. What I want to find out is, do you have to have all of these symptoms show, or the moment you have, say, a normal flu, you should be looking to test for coronavirus?
For these kind of viruses, they don't use only the clinical picture to decide on person being a suspected case of. They also have the epidemiological link. That means they will find out whether you have been to a place where you have had confirmed case. So all those ones will help to give the clinician an indication that you could be a suspect case or otherwise. So when, like the Kolebu one, I hear one of them had traveled to China before.
Yes.
So those ones were the indicators that they used to raise that suspicion level that, okay, then let's try and rule out the possibility of him having the coronavirus.
Okay. And also we've heard that those with respiratory diseases or a history of respiratory infections are more at risk. Is this true? Do we know?
Those with history of respiratory
infections.
I have not read more about that, but certainly if your immune status is more or less compromised, you become more vulnerable than somebody whose immune status is stronger. So you talk about older people and children will get more infected if they should have cases around. They become more vulnerable than people who are very healthy and their immune system is not compromised.
Okay. In that case, is there any advice before you go?
I think the Ghana Health Service has sent the facts around already about cough etiquette and also trying to wash your hands regularly with soap and running water and using the hand sanitizer, especially the alcohol-based one. If we do these things, some of these agents will not get exposed to them.
Doc, thank you very much for your time and for your patience. Dr. Kofi Boni, he's a senior research fellow at the Noguchi Institute for Medical Research. Now, if you didn't hear him, essentially the point he's making is that this is a new virus, like Dr. Bequin said. We're still learning more about the symptoms, and there are cases where the people are not even manifesting those symptoms, but they actually have it. He says that for respiratory, it's a combination of high temperature, signs of respiratory infection, etc. If you have these things, you want to report, and especially if you have been close to any of these places where the virus has taken root, you want to make that request. But also, if you have any issues with the immune system, people with lower immune system strength are more likely to be infected. So he points out to children and the elderly, but he says that hygiene, being hygienic, washing your hands often, not touching your face, and keeping to those basic things, they do help. In the meantime, the Ghana Medical Association is raising concerns about the safety of frontline health workers who are likely to be dealing with suspected cases of the deadly novel coronavirus. Divisional Secretary of the GMA for Greater Accra Region, Dr. Winfred Barr, says staff at the Kolebu Teaching Hospital panicked when the two persons walked in claiming they may have the virus.
Hospitals is adequate now. We are told that we have these two nationals. One is a Chinese, one is an Argentinian. And they just walked into the emergency room in Kolebu. Apparently, and this is what I was told, about 30 minutes ago before I walked in here. So they walked in, they didn't even come for a referral letter, they walked in. Apparently, they said they went to another facility, I won't mention the name. And when the people suspect, one is a Chinese, one is an Argentinian. So when they saw them with these Malays and all the same things, they were like, go to Kolebu. They didn't even attend to them. They said, go to Kolebu. But we were told that the centers are Ridge and Tema General Hospital. But they asked them go to Kolebu. So there's a problem with even communication. So they also came to Kolebu, they walked and they got into the emergency room. And then everybody is panicking. And according to the public health director, one of them, so the Chinese left China in September of last year. So we say that it wasn't within the period. But the other person who had been living with him actually got into he also was in Shanghai, but that was in January, and came down. And they've been living together. Now they all developed some symptoms that fits the case definition, but it doesn't mean they have though. They have some malaise. They say only one had catarrh, one of them had a catarrh, but with all the muscle pains and everything. So they've taken samples and sent to Noguchi. But we are taking another sample in the morning tomorrow. So I'm just using this as a scenario. See, are we prepared? The first thing is the communication line. So the first health facility they went to, if they thought that, okay, let's say they thought we are not prepared or we are not a center, what should they have done? They just said go to Kolebu. So there's a problem with communication in the first place. And then when they got to Kolebu, now everybody is, I've seen people sending me a lot of text messages. Hey, we hear there's a suspected case. There's panic.
And panic is one of the key things you want to avoid in any outbreak like this. Well, you've heard them say that the people there panic. We want to hear from you. What do you think? Share your thought with us on WhatsApp 0540109009. Let me speak to Dr. Ba, who is the Deputy Director of Public Health Department of the Ghana Health Service. Dr. Asiedu Bekwing admits. Dr. Asiedu Bekwing has admitted that there have been suspected cases and those have been dealt with. But let's get on the line. I do have Dr. Ishmael Norman, who is president of the Institute for Security, Disaster and Emergency Studies. Dr. Norman is also former chairman of the Ghana Public Health Association. Doc, thank you very much for your time this afternoon. It's good that we have you because I want to find out the issue that has just been raised by the final speaker who was on the line was about the available protocols. So yesterday, these two people walk into, let's say, any normal hospital, it could be a private hospital, and says that we think that we're seeing these symptoms. And they say, well, go away, just go to Kolebu Teaching Hospital. Between that facility and the Kolebu Teaching Hospital, they may come into contact with anybody. At the Kolebu Teaching Hospital, which is always, has a lot of people, they could have passed it on to people. What can we do, or what should have we done? What should we have done as far as the protocols are concerned? Is there anything you can advise on?
Okay. Thank you for having me. I think the clinic staff cannot really be blamed. I think that the fault lies with the Ministry of Health and Ghana Health Service. What should have happened was that when this disease came out, when we got news that the coronavirus is already active and people are dying or suffering from it, we should have begun the public health education in this country. But our authorities were behaving as if Ghana is an island which is protected from everything. And I think this is where the weakness is. Imagine if there had been more cases like that. Imagine if there had been real cases. Then you would have seen that our national preparedness for health emergency is really weak. Dr. Benaku yesterday on PM program together with Dr. Ban and Professor Ampofo were saying that clinically, I think we have enough, maybe 50% prepared, right? Okay. But when it comes to public education, because that's where it is, it's not the clinical interventions, because once we have the cases, the clinical interventions are going to be running behind the cases. And so you have to educate people so that they are prepared for it. And getting PPE is not the answer. The answer lies in preparedness, education, making sure that your quarantine isolation wards are ready. It's a joke when they say that Tema General and Ridge have the isolation ward. How many people can they contain?
Well, they use these hospitals because they came in handy when Ebola broke out. But you say that, won't you say that having the PPEs and having the test kits, etc., are both equally important, except that, like you're saying, people should know how to avoid it rather than how to deal with it?
It is essentially critical to have the PPE to protect the health workers. That is a given. But what about us, the population? There are many of us compared to the health workers. So yes, you got 10,000 PPEs. What about the rest of us? What are we supposed to wear to protect us? The protection we need is from the education.
Okay.
The public health education. Dr. Asiedu Bequin is speaking from a clinician's point of view that the hospitals are ready, even though I think it's not completely true. But from the public health education point of view, we are not there.
Okay. Is this something that your organization would perhaps want to reach out to the Ghana Health Service or to the Ministry of Health? Perhaps such an awakening will help. I'm sure they're looking for partners with which they can work this out. Is this something?
I think they all know who we are. They know, at least they know me. I have been in programs with Dr. Franklin Asiedu Bequin. I was speaking with him just last weekend. They all know me.
So perhaps you could team up.
They know me. But you see, it's not the people who are supposed to help that is missing. I believe that the government has not paid attention to this program. One other issue, making 2.5 million cities, which is barely $500,000 available for a disease of this nature in preparedness, is also a joke. Because even football teams, soccer, we provide more money for football games than this disease that is confronting 30 million Ghanaians.
So as far as you're concerned, the money, even the allocation, is not enough. Our preparedness not enough. Hopefully, we'll be able to team up and come up with a rigorous public education plan that will help deal with this. Doc, thank you so much for joining us.
You're welcome.
In this conversation. Well, Dr. Ishmael there, he makes a point about allocation. He thinks that government is not really paying attention to this disease. And even though they talk about the provision of the PPEs, etc., there's a lot more of us here, 30 million plus Ghanaians, who ought to be educated. Public education, that's his emphasis. Public education needs to be stepped up. The amount allocated, he thinks, is woefully inadequate. Let's head to the Greater Accra Regional Hospital, where a treatment center has been put in place. Should the deadly novel coronavirus enter the country. JoyNews' Ifwa Evans Chinwe has been touring the facility and reports that 35 staff members have been put on standby to deal with any possible cases. But medical director of the hospital, Dr. Emmanuel Sofenyo, says they may not be able to handle a lot of cases should the virus get into the country due to limited number of beds.
I'm here at the Greater Accra Regional Hospital, one of the health facilities designated by the Ministry of Health to manage possible cases of the novel coronavirus. And I have with me Dr. Emmanuel Sofenyo, the medical director at the hospital here, to tell us what exactly is going to happen if anybody comes in here with the virus.
We are at a center that we call the Infectious Disease Center. The Infectious Disease Center of the Greater Accra Regional Hospital. So, as I have explained earlier, the process starts from the emergency units. If a case is suspected or referred in as a confirmed case, these are the two possibilities that the patient may have just walked in herself or himself, and we will, through our screening process, suspect that it may be possibly a case, or confirmed case having been transported through an ambulance system to our doorsteps. When that happens, the necessary communications takes place, and then the patient is conveyed through our own internal ambulance system to this center. So the patients, we have two means of entrance to this room. We have the nurses' entrance or the staff entrance, and patients don't use the same entrance as the staff entrance. So the entrance that we came through is the staff. This is the staff entrance, And you see that when the staff...
This is the staff sitting area.
This is the staff sitting area, and it's supposed to be called the clean place, the clean area. Yeah. So when the staff arrives from home, he uses that door, and then immediately at the entrance, you see that there is a hand sanitizer dispenser. There's a dispenser there. From the house, she cleans her head, she sanitizes her hand before she comes to sit down. And then we are going to also deploy a ledger book over here. When you come from the house, you, the staff yourself, you check your temperature and make sure that you are indeed well before you are allowed to work within the environment. We wouldn't allow anybody who is already sick to work in this environment. So he checks, the staff checks herself and document her temperature to indicate that she's fine at the time she's reporting to work. And then if there is a patient to be looked after, then she makes a plan, a treatment plan, and then she goes to the next room, which is the changing room. And that is where she's going to don her gowns and the other protective, that is the personal protective equipment. She then dresses herself appropriately and then is ready to now provide her care. So these are the rooms. What you see next are the rooms which are meant for the confirmed cases. So this is what we call the treatment center for the confirmed cases. So we can get into one room so you can appreciate the full components. So as you can see, this is a well laid out place. We have a hand sanitizing system here so that frequently we will be educating the patients to be sanitizing their hands so that they do not contaminate the door, the doors, and then the environment excessively. So from time to time, they will sanitize their hands. She has his own washroom. It's not going to mix with anybody. They have their own washroom, their own bathroom, and so on and so forth, their own bed, and it is one person for a room.
So is that a male, female? I can see female on the bed sheet. There's a really medical word, female.
Yes. Each staff will be each patient will be in a different room. So we are not going to mix a man and a woman in the same room. So that.
For Evans Chinwe with Dr. Srofenyo, they're going through the facility that's meant to be a holding area for in case the novel coronavirus reaches here. In the meantime, the Interior Minister says government is working tirelessly to keep the virus out of the country. The assurance comes after heads of NGOs in health called on authorities to step up surveillance at the country's entry points. Ambrose Derry says all measures earlier mapped out by the Health Ministry to Parliament are strictly being followed, especially at the borders.
Coronavirus, I'm sure the Minister for Health went to Parliament and rolled out the program that we have to check it. I can assure you that we are going to follow it religiously, and we believe that with those measures in place, we hope that we can, just as we did in the case of the this other one, Ebola, that we would be able to keep it out. What I would say is that we are appealing to all Ghanaians who are coming from China to submit themselves so that we can make sure they go through those, and we have also appealed to the Chinese to make sure they do the same. They're assuring us that they will do to all those who are before they come to Ghana, but even when they come, we want to be assured. And I'm happy that all of you are alive to it. Help us so that we can together protect Ghana. Thank you.
Obviously, the amount of interaction or the number of interaction that we have with the epicenter of Ebola is different from the interaction level that we have with China. We do business in China. Chinese come here a lot. I would love to hear from you. What do you think? Do not panic, by the way. Health authorities say they are on this situation. They're dealing with it. I'd like to hear from you. Send us a message on 0540, a WhatsApp message, I should say, 0540-10-9009. That's 0540-10-909. In the meantime, as I wait to read your messages, here is what you should look out for.
Need to know about the coronavirus outbreak in China. The WHO calls it novel coronavirus, or 2019 nCoV. It is a family of viruses consisting of SARS, MERS, and Ebola. It spreads very quickly and can be very deadly too. It is spread from animals to humans and can also spread between humans. Symptoms include fever, persistent cough, impaired breathing, running nose, skin rash, persistent vomiting, and unexplained bleeding. Is there a vaccine? Well, this is a new outbreak, so there had not been any vaccine until January 27th, when Chinese scientists announced a new vaccine which is said to be doing very well. Other scientists around the world are also working around the clock to develop a vaccine. The Ghana Health Service and the WHO both advise people to frequently wash their hands with alcohol-based hand rub, or what we call a sanitizer, or warm water and soap. Cover your mouth and nose with a flexed elbow or tissue when sneezing or coughing. Avoid close contact with anyone who has a fever or cough. And if you touched a surface suspected to have been infected, do not touch your eyes, nose, and mouth before you wash your hands. Avoid eating raw or uncooked animal products, and seek medical help immediately if you discover any of the symptoms, and share your travel history with healthcare providers. If you do these, we'll all be safe.
Food for thought for you, something you should bear in mind as far as we're dealing with coronavirus is concerned. Just quick messages here. Good afternoon. This one says, it's from Solomon. He's a nurse in Kumasi. He says, kindly ask the doctors that since they've confirmed that the suspected cases are not coronavirus, have they been able to go further to know what conditions these people have? They can't just leave us in a vacuum like that. Thank you for your message, Mr. Nurse. Who brought in that one. Daniel from Daniel Atabankwa from Techiman says public education should be strengthened in Ghana in respect to this coronavirus. Now people have become scared when they see Chinese and they don't want to get close to the Chinese. Let's put politics behind us and step up education on this virus. Daniel, thank you very much for your message. Please, government should pay attention to the Chinese embassy. There are more Chinese coming in and out with us. Ya sends this message from Koforidua, and this is from Lawson in La Paz. Lawson says, good afternoon, Gifty. Please, those two nationals should please be placed under observation for 14 weeks because we cannot take chances. But let Ministry of Health and Government know the fund allocated cannot go anywhere in fighting this. So again, about the amount allocated to dealing with this and about what we're doing after we've confirmed that those cases are negative. What condition really do those people have? Let's take a break here. This is still The Pulse with me, Gifty, and Doapia.